What happens if a woman takes Viagra? Viagra, the famous little blue pill, is a medicine used to treat erectile dysfunction. What would happen to someone without a penis who takes the medication? Viagra works in men by increasing blood flow to the penis. Similarly, it is thought to increase blood flow to the female genital area. It increases lubrication and facilitates orgasm in women. Thanks to this idea, research has been done on women who take Viagra, but the medical tests so far haven't shown that Viagra works for women in a big way. So, unless you meet the criteria and get the okay from a doctor, you should never try Viagra if you're a female. Seriously, let's go exploring with that in mind. What is Viagra? Viagra is a prescription drug made by Pfizer to treat the symptoms of erectile dysfunction. Let me tell you that the magic ingredient is sildenafil citrate. It was first thought of as a possible treatment for hypertension and chest pain, but the drug had a strange side effect. It gave guys boners. That sparked an idea. Since people of all ages often have trouble getting and keeping an erection, there was a clear market for an oral pill that safely caused erections. Finally, in 1998, the US and the European Union approved the drug for medical use to treat male impotence. How does Viagra work? Next, you might be wondering, how does this little pill work? What's the science behind it? Does it rewire your emotions or what? Or does it ring a bell in your brain? Well, the medicine was supposed to inhibit the action of an enzyme known as PDE5. Inhibiting PDE5, sildenafil, and similar medications removes the brakes from the erection process. This boosts the blood flow to the penis. It works by dilating the arteries and relaxing the smooth muscles in the penis. Finally, it allows the penis to remain relaxed for longer. Why would a woman need Viagra? Women obviously cannot have erectile dysfunction, that's for sure, but that does not mean they cannot have sexual health and function problems. Female sexual dysfunction, or FSD, is a common problem for women. It can have a much wider range of symptoms and is different for every woman. One study of 400 women suffering from female sexual dysfunction focused on their specific challenges. These symptoms included low sexual desire, lack of arousal, lack of lubrication, and being unable to achieve orgasm. About 42.5% of women reported experiencing excessive pain while doing the deed. Maybe this is what inspired a few women to try out Viagra. They might have assumed it would arouse them like that of men. What would happen if a woman were to take Viagra? Viagra helps men maintain erections by increasing blood flow to the penis. This is what we already know. Now, why am I repeating this again? Let me tell you. Nitric oxide and cGMP have a similar effect on women as they do on men. Both play a role in sexual function and women's orgasms by controlling blood flow. For a woman to have an orgasm, she needs a certain amount of pressure in her genital and labial areas. These pressure levels are maintained by increased blood flow into the clitoris. So, there's reason to suppose that Viagra and similar drugs can help women. Let's dig in further. Can Viagra treat women? What does science say about it? One question that has been asked is if it could help women with low sexual desire. A small study published in 2008 discovered that sildenafil may help women who struggle to feel sexually aroused when using antidepressants. However, there is no reliable evidence that it helps women who have reduced libidos. In 2002, for example, a larger randomized clinical trial was done to see if sildenafil could help women with female sexual arousal disorder. It didn't have a big effect. A study from 2012 came to the same conclusion that sildenafil did not make women with sexual arousal disorders feel more sexually aroused. Another volunteer study discovered that sildenafil has no benefit for postmenopausal women with genital female sexual arousal dysfunction and orgasmic impairment. Also, since the drug is mainly used by men, there isn't much information about whether or not it is safe for women. This means that the drug was probably only tested on men to treat erectile dysfunction, and its effect on women is unknown, especially in the long run. But there is a real need to learn more about how sildenafil affects women, since the drug might be helpful for other conditions. A study from earlier this year found that Viagra can make men with heart disease live longer and reduce the chance that they will have another heart attack. Another intriguing study recently suggested it could help prevent Alzheimer's disease. Is there a risk of side effects when a woman takes Viagra? Clinical trials and research on the harmful effects of Viagra were entirely conducted on men. That's normal because it's officially meant for them. However, modest research on sildenafil in women reveals that the adverse effects of Viagra in women are similar to those in men. Viagra may reduce blood pressure, especially within a few hours of taking it. This can be an issue if you already have low blood pressure or are taking blood pressure medications. Some of the most common side effects of Viagra include flushing in the body or face, indigestion, abdominal cramps, and diarrhea. You may also experience headaches, migraines, nasal congestion, or a runny nose. More seriously, it can cause symptoms such as heart palpitation, shortness of breath, nausea, and vomiting. You may notice visual changes such as hazy vision or a bluish tinge. Is there a female Viagra for women? You may have heard about female Viagra, but that term is misleading. When people talk about female Viagra, they usually mean the drugs flibanserin sold as little pink pills under the brand name Adyi, or bremelanotide, which is sold as Vilisi. Recently, the FDA has approved both of these drugs to treat acquired generalized hypoactive sexual desire disorder in premenopausal women. This is basically a lack of libido. But there is a lot of disagreement about these drugs. Unlike Viagra, which causes a purely physiological condition, these two medications affect brain chemistry related to emotion and thought. It is unknown how beneficial they are because the results are varied and connected with adverse side effects. The bottom line: Viagra is an FDA-approved treatment for erectile dysfunction in males. It is not approved for use in women, and trials have shown mixed findings. There is no female Viagra, but a few medications are approved to treat sexual dysfunction in specific women. There are several reasons why women have a low sex drive. If a woman takes Viagra, don't expect fireworks. You got to understand this. Before taking Viagra or any other medicine, see your doctor. Inquire about the drug's potential benefits and negative effects. Thank you for tuning in. If you enjoyed the video, please click the like button. Do subscribe to get updates about what's new on our channel. What update should I cover next for you? Let us know in the comment section below.